Hello, my name is Teresa Strike. I work at Central Gippsland Health, and that's based in a regional area in Victoria, Australia. And I'd like to tell you about my journey. I joined Central Gippsland Health in 2014. It was a post funded by the Department of Health. The remit was to improve health outcomes for people struggling with addiction. I originally started as a nurse consultant, and since then I've done my training to become a nurse practitioner. So my work was actually to build clinical knowledge and capacity for the clinical staff within the settings, and write policies and procedures and all those kind of things. And during that time, I established 2 elective withdrawal beds based in the hospital, which was great for the community. During the course of this time, it became glaringly obvious to me that what my patients lacked was the correct community health supports to support their recovery journey and to address their health needs. There were so many acute presentations of illnesses that had exacerbated and didn't really need to get that far. So many unaddressed mental health problems, often put down as alcohol-related psychosis, all these kind of things. Basically, people weren't having their proper immunisations, they didn't have access to local pharmacotherapy services. Yeah, there was a lot going on. So I decided that we would go forward look at an innovative nurse-led practice model and base a pharmacotherapy and well-being clinic in the community. And that was really exciting. What we offered people was 30-minute appointments. You think of a GP, they're lucky if they get 5, even if they can go to see a GP, because in regional areas there's often a gap imposed for people, financial gap, and it's really hard to find bulk billed GPs. Access to psychotherapy is very difficult as well, because that often comes with a big gap, and that may be from $100 to $150 a shot, really. So that was really difficult. So what we did offer, and I will just read out so I don't forget any of these things. What we did offer, and I don't want to miss out, was we offered pharmacotherapy and the new kind of interventions, such as long-acting injectable buprenorphine, which the patients really loved, needles and syringe programs, Hep C treatment, Hep B vaccinations, naloxone education, most importantly at all, medical workouts, help to navigate the health services, and support with onward referrals. Often people just really get lost in the system or just get banged from pillar to post. So we were working in very close partnerships, who were in the same building, with maternity services, so with the obstetricians, with the gynecologists, with the maternity staff. And we were able to kind of get into the crux of dual diagnosis treatment and look at that chicken and egg situation around mental health and alcohol and other drugs. We offered ambulant detoxes for people who didn't want to come into hospital, and titration services as well. And I think most important of all, we were helping patients make informed choices about their health and where they wanted to go. We do education on neurobiology of addiction, substance education. We get a brain out and says, this is where it all starts, and we talk about trauma and how that affects the brain wiring. And so our patients now make informed choices. So since establishing the clinic 18 months ago, I'm seeing some real positive outcomes. I've seen a reduction in ED presentations. I've seen not many overdoses at all. real uptake and treatment, because I think once you get that kind of connection with community, you find that, you know, Fred tells John, who then comes, and it's a really nice vibe. And the patients often say to me, "Oh, it's such a nice place. We're usually stuck in a corner in a broom cupboard somewhere." I've had some of my long-term drug users are now in employment. We're seeing needle and syringe distribution and reducing between 30 and 50%. We're seeing healthy pregnancies. We're seeing healthy newborns. We're seeing, and lots of my patients say to me, "Oh, you know, the reason we don't come to maternity services is because actually, not because we're frightened that child protection get involved, but it is more about how we're judged, and you know you're judged." So coming along to the pharmacotherapy and well-being clinic, we're actually greeted with happy faces and good care, and given lots of education around the treatments we can use and help with reductions in drug use, all those kind of things. We've had children reunited with their parents, which has been great because they made such great steps. And we've seen a reduction in incarceration rates. Well, for one example, one of my gentlemen said to me, "Terry, this is the first time I've been out of prison for a whole year. The most I've been in prison since I've been 16 on and off. I'm now 45, and the longest amount of time I've ever been out of prison is for 3 months." So that's what I'm saying. As nurse practitioners, we can make such a difference. We can actually offer patients holistic care and help to really get to grips with their recovery journey. Thank you for listening.